Hello, good evening, and welcome to another episode of SCAUK Live here on the Sudden Cardiac Arrest UK YouTube channel. My name is Gareth Cole, and once again, I will be your host for this evening. And tonight's episode is entitled The Role of the Rehab Team. We had a session a little while ago where we talked about living with ICDs and that sort of thing, but of course not everybody has an ICD. Quite a lot of cardiac arrest survivors, like myself, we had a heart attack that led to our cardiac arrest. So we don't have an ICD. So we thought that tonight we would talk about the role of the rehab team and getting back to good health after a heart attack. Heart attack and a cardiac arrest. And as always, I am joined by my fellow trustee of Sudden Cardiac Arrest UK, my good friend and my co-host for this evening, still fabulous, Joanna Balgarnie.
I love that. I love being still fabulous. Well,
how are you doing this evening?
Yeah, very well. Looking forward to this.
Yeah, I'm looking forward to this as well. This is going to be great. And it's going to be great because we did call it the role of the rehab team, and we do have a rehab team. We have not one, not two, but three cardiac rehab, I'm going to say nurses, and that's completely wrong. But there we go. So let me introduce, two of them are actually sitting together. So I'm going to introduce you to Julie Hambling, who is a cardiac rehab sister at the Essex Cardiothoracic Centre and the lead for cardiac rehab, and David Massam, who is a cardiac rehab physiotherapist, again at the Essex Cardiothoracic Centre. So Julie and Dave, thank you so much for being here. Good evening.
Good evening. Thank you for having us.
Oh, you're more than welcome. Absolutely more than welcome. Thank you for being here. And we are also joined by Debbie Whitfield, who is the cardiac rehab lead for Mid and South Essex, which incorporates the Essex Cardiothoracic Centre. And I am reliably informed that we should refer to her as the big boss. So, Debbie, good evening. How are you?
Hello. Thank you for having me. And I'm not the big boss, really.
Well, you're going to be for the purposes of this evening, I think.
Thank you.
So, guys, if you're watching on YouTube, as always, this is your access to experts. So we have some topics that we're going to discuss this evening. We have some topics that we're going to discuss between us this evening, and you would like to join in, do tag us in chat, in YouTube chat at SCAUK. And we will try to answer as many questions as you can. It doesn't have to be a question, can be a comment, can be just some kind of interaction, but do please feel free to interact with us. Right, I've done some quick introductions, but as always, we never assume that people know who we are. So I'm Gareth Cole. I'm a trustee of Sudden Cardiac Arrest UK. I am a two-time out-of-hospital cardiac arrest survivor. I'm your host for this evening. Joanna, would you like to quickly introduce yourself and tell us who you are and why you're here?
Yes, indeed. Hello, everyone. I am also a trustee of Sudden Cardiac Arrest UK. I didn't have a heart attack before I had my sudden cardiac arrest. So I am an idiopathic survivor, but delighted to be here and really interested to hear about what cardiac rehab means for those lucky ones who are able to get it.
Okay, something went wrong there, but never mind. And Julie and Dave, would you like to just quickly introduce yourselves and tell us what you do and why you're here? I do love, hang on, I've got you muted for some reason. There we go.
Julie and David, you're muted.
Let's try that again. I don't think you're muted. Sorry, Julie and David, you were muted. Would you like to introduce yourselves and tell us who you are and why you're here?
We're back in the room. And my name is Julie. I'm one of the cardiac rehab leads for the Essex Cardiac Trust. And we're here tonight to share with you what cardiac rehab is and the role we play in recovery.
My name's Dave Massam, and I'm one of the specialist cardiac rehab physiotherapists that works at the Cardiothoracic Centre as part of Mid and South Essex.
Fantastic. Thank you so much for that. And lastly, Debbie, the big boss. Debbie, would you like to introduce yourself? Tell us who you are and what you do.
Hello, my name's Debbie Whitfield. I'm the lead nurse for cardiac in the Mid and South Essex NHS Trust, and part of that is the Essex Cardiothoracic Centre cardiac rehab team. So I sort of manage the 3 rehab teams across the 3 sites. So.
Fantastic. Thanks, Debbie. Okay, so we have some questions lined up that we would like to discuss with you guys this evening, but we wanted to start with a fairly, I would hope, a fairly simple one. Joanna, you had that lined up, I think. Do you want to just ask quickly?
So we'll start off, if that's okay, with starting with Julie, and Julie, you pass it on as you think fit. So the question is, can you explain the role of the cardiac rehab team and what support you provide?
Okay, so the role of the cardiac rehab team is very much what we would call a multidisciplinary team. So that involves nurses, doctors, dietitians, physiotherapists, therapists, counsellors, all the people that would be involved in people's care right from the beginning of your heart attack through to your end recovery, and you move on independently. So in our centre, we would go and see our patients soon after they've had their heart attack, they've had their cardiac arrest, they've had their surgery. We explain their diagnosis. We will ask them what they're worried, they're concerned about, talk about medication compliance, assess their cardiac risk factors, and really just touch base with them to let them know that when they leave the hospital, they're not alone. There is a port call. Because what a lot of our patients will say to us is that when I'm left, I feel I'm alone. I don't know what's happening. A lot of the words that we use in hospital were terminology, and I don't understand what it means. What does this mean for me in my recovery? And we're the team really that are with you at every stage of your event. So right at the beginning, soon after you've gone home, all the way through your recovery till you are happy to be independently working on your own. So we're there really to work with you, assess your needs, assess what support you need from us, your family and your friends, and actually support you through that journey till you feel confident to continue life as what was your normal. Add to that.
Yeah, I think that covers most of it. I think the cardiac rehab process is really about putting the patient in the centre and trying to identify their needs and support them through their journey. That's really what we're trying to achieve. So therefore, that rehab looks sometimes a little bit different depending on what that individual needs.
Okay, fantastic. Debbie, would you have anything to add to that?
I think pretty much Julie and Dave have covered it, to be honest. But yeah, it's it as we talked about, it is multifactorial, and we put the patient at the middle, the holistic approach, and try and get them back to what they were doing before or more, and look at what their risk factors are, look at what needs they have, and just work with the patient, to be honestly. Yeah.
I'm interested that you say "and more." Oh, hang on. Oh, no, I'm not. I'm interested that you say "and more" because I was a physical disaster before my cardiac rehab. So I don't know how you would assess like success, especially if you're dealing with me. But okay, thanks very much for that. Joanna, did you have a question?
Yeah, no, I was just going to say, picking up on the same thing as you, the "and more" is fascinating because we have a lot of conversations in our group about the new normal rather than getting back to normal. It's interesting to hear you say get back to normal and perhaps more. So that's quite an interesting. I've not heard that before, if I'm honest. Debbie?
I think we're going to come to that in one of the questions that we've got sort of queued up. So let's let's bring up the first one, and this is slightly more specific. I'm going to read it out, because if I don't read it out, there's absolutely no point in me being here. And then hopefully Debbie, Julie, and Dave, you'll attack it. So, what are the main goals of cardiac rehab? Is it physical recovery, emotional support, lifestyle changes, or all three? So Julie and David, can I come to you first for that one?
The main goals of cardiac rehab really incorporate all of those three things: the physical recovery, the emotional support, lifestyle changes. Not one patient comes with, everyone's unique. And you might have a young 30-year-old that has had a heart attack, had a bicycle in, and they just want to get back to work, get back to the gym. You might have somebody that's the same position, but emotionally they're really struggling. The lifestyle issues, I think it's really important to tackle as a whole. If you tackle one, you then hopefully impact all of the others. So most people will need input in all of those. However, depending on what their needs are, what their goals are, where they were, or where they want to get back to. And what we can see is realistic. We see so much potential in people, but they're scared to get back to things. So sometimes people don't realise emotionally they've been challenged by their event because they haven't unpacked it, they haven't explored it, they haven't felt safe enough to do so. So I hope that's something that we enable them to do. But the main goal is to get them back to their old self, but also more. Because a lot of the population are actually not doing as much as they should be doing to actually be as healthy as they possibly can. Yeah. And the target is to get people as well and as fit as possible. So we see potential in everybody that actually they can do more, and we're there to facilitate that recovery.
I think Julie's right there. I think for me, the main goals of cardiac rehab are the patient's goals. And I know that sounds like it's sort of sloping off the issue, but actually it comes from the assessment and the conversation about this is what we can offer, and together maybe we can come up with some ideas and collaborate on what you might want to achieve in whatever time frame we've got. Now that might be physical. If someone had a sudden cardiac arrest at the gym or doing something physical, that might be really traumatic for them to re-engage with exercise, and that might be something I can try and help support with. It might be educational. It might be that we need to help them in an emotional or psychological sense, or refer them to someone else where that's more appropriate. So it's really, as Julie said, there's things that we will cover for everybody, but the goals of rehab are really what are you guys, what are your goals, how can we help you guys? That's really what it comes down to.
When is that assessment made, David? Because my memory of cardiac rehab, and I'm going back 12 years now, so over a decade, is very much that it was a preset program, and you either attended and did that program or you didn't. There didn't seem to be a huge amount of assessment going on. I mean, I remember being put on a bicycle, well, not a bicycle, but a treadmill bicycle, if you like. My heart rate was monitored, and I was told to, cycle for I don't know how long. Don't let my heart rate go above 120 beats per minute. I think it was that. But what I do remember, I was on a massive dose of beta blockers, and I was cycling my heart out. I was checking my heart rate, and it was like 60, then 61. If I'd have got up to 120, I'd have been in Venezuela by the time.
Yeah. So to answer that, every centre will probably, the timeline will be a bit different, but the assessment is ongoing from when we meet you. So as Julie was saying, as a tertiary centre, we meet our patients very early, and some of those will then be referred out to their local areas. But for our patients, then that assessment of their needs happens from those first phone calls, because it's in an introduction of, we are your local cardiac rehab service. We would like to engage in conversation with you. How are you doing? What can we help with? The physical side that you're talking about, the assessment on the bike and the heart rate, still exists. We still do that regularly. But there should be an assessment for the patient's psychosocial well-being, emotional state, but also their lifestyle risk factors, which particularly for the, as you said, for the heart attack side of cardiac arrest, we know that the lifestyle factors for that can, well, for all of it really, but particularly in that there's things that we may need to address. But for all of our patients, we would go through what things in their lifestyle do they, yes, put them at risk, but what things do they feel are a problem? What would they like to try and improve or get a handle on, and then formulate a plan forward from there. So where it happens might change, but it's the earlier the better.
Okay. I did mention earlier on that I quite often have a light bulb moment, and I have questions that I come up with as we go. We are obviously a cardiac arrest charity. Maybe this is a question that I could ask of Debbie, because she manages three different centres. How is the cardiac arrest considered in this process? Because again, my cardiac rehab was very much because I had a heart attack, very much focused on the heart. The fact that I'd had a cardiac arrest was completely and utterly incidental, and basically, to be honest, ignored by the particular centre that I went to. Is there any difference in what you do between a heart attack survivor and a heart attack and cardiac arrest survivor? Debbie, can I ask you that?
Yeah, there is at the tertiary centre. There is also, as you probably know from the Essex Cardiothoracic Centre, there's also what's called the care clinic. So we've got access to the care clinic, which is a clinic that every patient that's had a cardiac arrest will attend. So we have those people as well. We've also got a psychologist attached to the service, all three services, that quite a lot of our patients that come through with a cardiac arrest will actually access. So there's a lot more for people that have actually had a cardiac arrest now. I think, as you said before, sometimes what was looked at was the actual heart attack, because then you can look at the risk factors, you can look at all these other things which are pertinent to most people. Even if you haven't had a heart attack, a lot of people have some risk factors for cardiac disease, so the education can still be pertinent to those people. But yeah, there are other things that we can refer to. So we, as we said before, we have the care clinic where we have a specialist nurse that sees every single patient that has a cardiac arrest, and there's a team of people. There's a team of people within that as well. Julie, Dave, do you want to add to that at all?
Yeah. So, Gareth, what was the question again about what's the difference?
Well, with my cardiac rehab, the fact that I had a cardiac arrest was completely and utterly incidental.
Okay,
right. Yeah.
But
yeah.
do you do anything different with within the rehab team? Do you do anything different with people who have had a cardiac arrest?
Program. We don't have a separate program for people that have had a cardiac arrest, because we have a strong feel that all the information we share is important to everybody. Every patient's individually assessed. So if you have had a cardiac arrest, we wouldn't do your gym circuit really any differently. We might be looking at your levels that you're working at, depending on what your heart function, things like that are. And that's more really for us to do in the background, because what we don't want to do is say your event's far more serious than the person next to you. We want you to come into our group, get the peer support from everybody, get our support, and get you back to what you're doing. So we like to integrate all of the cardiac events that we cover all together. I know some centres have high risk patients, low risk patients, cardiac arrest patients only, and sometimes that can make you feel different or isolated, because why am I not in with the same group as everybody else? So it kind of just that it normalizes your event, and doesn't make you think, oh, I'm at more risk than somebody else. So we try to incorporate all the patients into our group, treat you all the same. However, the individual holistic approach is always guided. So you may have these particular cohort of patients that are far more emotional, because something happened, they're young, their family have witnessed this, and then we will address that. Likewise, if we're dealing with a different cohort of patient and they let us know what their issues are, we'll deal with that as well. So it's very individually led, and we try not to isolate anybody away from any different groups.
Okay.
I also think.
No, go on, Mark.
No, sorry. All I was going to say was the individualized aspect, and I hear what you're saying about the cardiac arrest was overlooked, and I absolutely can see that. But I think for me, we are dealing with you as a person, not the cardiac arrest. We're dealing with you. So if your needs are exercise related, I will, and my colleagues will help identify, do you need to be stronger, fitter? Do you need to be reassured regarding exercise? Is it okay for my heart rate to go up? What if it happens again? What if? So it's really about trying to meet those needs. Now, I would do that regardless of what pathology you had. So I might know you've got a device, or you had a cardiac arrest or a heart attack or surgery, and that I might need to take that into account. But I'm treating you, not the cardiac arrest, if that makes sense.
Makes perfect sense. It's a bit of a juxtaposition, because I remember when I got home, I've got a partner who wanted to wrap me up in cotton wool, lay me on the sofa, and make sure I've never moved. And then I've got you guys who want me to jump up and down mountains.
Gareth, can I come in?
Yeah, Joanna, would you like to come in?
Yeah, simply because we've had, as expected, a couple of questions, both from Zach and from Mark, saying, as we expected, that they have had, I think both of them are idiopathic.
Let me bring Mark's up.
Yeah, there's Mark's. That's his question. So he's had an ICD and he's had none of the support that we're talking about. And Zach's the same, that he says that the track for cardiac rehab for versus cardiac arrest versus heart attack seems wildly different. And we totally agree with that. And I wondered if perhaps Debbie, because I think lots of people who will be watching will feel this. Those of us who didn't get any access to cardiac rehab, especially when we're hearing now about these fantastic things that you're offering, there is that feeling, why isn't it available to everyone? Obviously, money is essential.
Yeah.
What's your answer, Debbie?
I think the thing is, with cardiac rehab, it's completely different in every area. And unfortunately, there's some areas that are basically a one-man band. So you've got people that will see somebody on a ward, but then they've got no access to have any type of multidisciplinary classes or any of these things at all. I think for years and years and years, cardiac rehab was seen as like the Cinderella service, really. It was sort of seen as an add-on. It was seen as something that was okay, you know, oh, that'd be nice, we could have that. And I think now what we're seeing is that cardiac rehab is part of your recovery. We're trying to change the language. We're trying to get it out there to say, this is as important as taking your tablets. This is as important as your outpatient's appointment. This is part of your recovery. So this isn't, what we are doing from our trust is we're saying, this isn't an option. This is something that is part of your process. Unfortunately, across the country, that's not the same. I think where we are really, really lucky that we've got teams of people that are wanting to do this, are motivated to do this, and we shout quite loudly. The money in the NHS at the moment is very, very tight, and it isn't the same, and it is a real travesty, I think, because this should be part of the people's recovery. It's shown, you know, it shows that cardiac rehab reduces your risk of other events. It reduces people's anxiety. It gives people support. We know all the real massive benefits. It gives people confidence to be able to go and do things. So it's not just, you know, as people think, oh, cardiac rehab, it's a bit of an exercise program and that's all we do, blah, blah, blah. It's a lot more than that. But unfortunately, it isn't the same across a lot of trusts, and a lot of areas have to look at what they've got and what their capacity is, and then they look at what their criteria is. So it might be that a cardiac rehab class in, I don't know, anywhere. We'll only see patients that have had cardiac surgery, or we'll only see patients that have had a heart attack. They won't see any other types of patients. And we know that a lot of patients with lots of different cardiac conditions benefit from cardiac rehab, but there's not just a pot of money there, and it's what the trust managers and things sees as priority. So we're very lucky because we have shown what the benefits are. We have got a very good uptake. People get we get good reports from our cardiac rehab. So basically, we're very lucky, I think, in our area, but it's unfortunately not the same across the whole of the country, which is a shame, a real shame.
And
guys, Joanna, did you want to come back? I'm just conscious that we're already half an hour in and we're on question 1. So
thank you, Debbie. That was so valuable. And I just want to go back, because Zach has come back to us as well. And actually, Zach isn't even in the UK. So really grateful and delighted to hear what he's had to say. So he was saying, as we've got there, what I was trying to convey is that cardiac rehab Midwest US helped me rebuild my confidence after my SCA, which goes exactly to what Debbie said. Everything frightened me early on, and you're not alone in that, Zach. That's so true. And the rehab helped me push into that. So yeah, we'd love it all to be available to everyone. But the message is that it isn't. And so we're focusing on the cardiac rehab that is available at the moment. That's me.
Okay, if it's okay with you guys, I'm going to move on to question 2, or topic 2, question 2. I'm probably going to come to Julie and David for this one as well. So this is, what does a typical rehab program involve? That may not be a very fair question. There's maybe not a typical rehab program, and I think we've talked about it a little bit anyway. But the interesting part of this question is, how is progress monitored, and how is that shared with the patient? Julie and David, can I come to you for that?
Yeah. So a typical rehab program really fundamentally has the components of exercise and education. So every program will deliver an exercise component, and every program will deliver an education component. How that is then delivered is very different. So we will deliver ours face-to-face in our purpose gym. It may be a home program, it may be a virtual cardiac rehab program, it may be telephone contact. Education is very discursed, would you say, rather than us just talking to you. And it's really to promote more questions and how you can work out where you need to go. So the fundamental components are exercise, education, psychological input as well. They would be the main components. How long that program lasts for is very individual. We are guided to say that the minimum should be around about 8 weeks. However, if you think from when you start with the patient, as soon as you see them on the wards, we are lucky enough to cover the wards and capture our patients very early till when they finish. That may be 6 months. I've had patients, don't tell the big boss, I've had patients that might have stayed with me for a little bit longer, because they're waiting for ICDs often, or they're emotionally still needing support. They're tackling a risk factor and they're doing really well, and they just want to stay in touch with you. So how long that journey can be, you might get somebody that needs you for longer than a few months, and you might get someone that says, do you know what, I'm all right after the first couple of sessions, I'm going to continue independently. So we're very much guided by that patient and where and how they access that support. Say that.
Yeah, absolutely, I would agree. And I think, like, notwithstanding what we've talked about already about whether what caused the sudden cardiac arrest, whether it was a heart attack or not, if we met you there and identified those needs, really it goes from there. We've talked a bit about devices. If there was a delay in making that decision for several weeks, months to have the device fitted, we would meet you early, go with you to that point, have the device, and then you'd start. The 8 weeks would then start from when you start with us. And all those weeks we've continued with you is just part of that journey. The 8 weeks still counts. Does that make sense? Yeah. So some places will offer a lot more than 8 weeks, but as Debbie was quite rightly saying, it's very dependent on the capacity in all regards, the financial, but the physical, the capacity of the service to meet those needs, what they have available.
I've just done my normal trick of talking with my microphone muted, so I managed to do that at least once every week, and I've done it tonight, so I feel better about that now. Debbie, do you want to add anything to that?
I think they've pretty much covered it, to be honest. Yeah, they've pretty much covered it. I'd just be saying the same.
Okay, that's fantastic. Joanna, anything to add?
Yes, I'm afraid we're coming back to the same thing again. Sorry, guys. So Mark has said it. I know he won't be alone in saying this, so thank you for saying it, Mark. Understand the budgetary constraints, which Debbie mentioned. But what do those of us who haven't got that do? Who do we reach out to? What are alternatives? Have you got any programs, any suggestions on what people could do? Perhaps be Debbie.
Oh, I can answer that one. I don't mind.
Oh, sorry, Julie.
Oh, going to me. Oh, who's going there? So, you know, if you're in a situation where actually the criteria or the funding's not there, I think you then have to look at, you know, we will try and then say to our patients, if we haven't touched base with them or they've rung us and they've gone, I can't do rehab. We look at the community services. I think people really overlook what is available in your local community. If you actually looked in your local GP surgeries, your local community hubs, there's your well, for us, we've got the Essex Wellbeing Service, you've got your signpost services at your GP, you've got weight management classes, you've got GP on prescription. I think there is a lot out there that people can access as well. It doesn't have to always be tailored with a cardiac rehab team. It's great, you get our expertise, you get our support, you get guided. But there's also a lot of other healthcare professionals in the community that are able to support these people as well. So don't be frightened to look in your local centres, look in your GP surgeries, look online at your wellbeing services and see what's out there. And you'll be surprised, actually, there are a lot of exercise on prescription GP referrals that are running the local sports centres with really excellently trained professionals that can also help as well.
Yeah, I mean,
What would you say is first step? What because I think that advice is fantastic. It really is. And I know we all know from our GP surgeries that those things are available. But do you go and see the doctor? Do you ask for an appointment with the nurse practitioner? Who do you go and see? You're sitting at home, nobody is contacting you, you're sitting there. What do you do?
Yeah, so I mean, having a look at the NHS website, by all means pick up the phone to your GP, even if they then refer you to a social prescriber or book an appointment with the practice nurse. I can't, whether you're, and we've talked about the whole cardiac rehab issue, but I don't know many cardiac rehab professionals that if somebody rang and said, I just need some advice, I'm a sudden cardiac arrest, you know, I appreciate that I'm not eligible, I'm idiopathic, I'm not eligible for your service, but I need support. Part of our role, whether you get 8 weeks, whether you get all this access, part of our role is to signpost people. So even if they in your local area, they may know people, they may have links with people to say, no, unfortunately, we can't bring you into this, but speak to this person and start that ball rolling. That's what I would suggest.
That's fantastic. That's so helpful. Thank you, both of you. That's brilliant. Hope that helps you, Mark.
Okay, yeah, Mark, thanks for the question and thanks for the input. I'm going to move on to question 3, if I can find it and if I can bring it up, and I don't mind. Here we go. No, it's gone again. So, it means cardiac rehab. I don't know why it doesn't say that. Is cardiac rehab tailored for somebody experiencing fatigue, cognitive changes, PTSD, or fear of exercising? I mean, I have a pathological fear of exercise, and I'm trying to avoid that on a regular basis, but I don't think that's quite what the question means. Who would like to tackle that one?
Yeah, I don't mind.
David.
Right, so I mean, I'm my bosses will join in, I'm sure. But yes, is the short answer. Yes, it is tailored for those things, because it comes back for me and all the professionals that I see that work in cardiac rehab. it really comes back to dealing with you as a patient again. So if one of you came to rehab and fatigue was a real issue, I need to work around that. That might be to look at the length of the session that you have with us. Maybe that exercise is not particularly what you need at that particular time. Maybe we need to kick that can down the road slightly or shorten the session. Maybe it's other forms of fatigue. Maybe we're trying to help you with pacing in terms of daily activities so that you're not having like a boom and bust cycle. Good days where you're doing a lot and then really struggling in other days. And not just physically, but emotionally, good days versus bad days. If it's a cognitive thing and someone's presented with cognitive difficulties or changes, has that been assessed? Do I need to help, or do we as a team need to get somebody to support with assessing that? And depending on those cognitive changes, what's the right access for you? So if it was PTSD and it was exercise related, which might go with the fear of exercising. My sudden cardiac arrest was at the gym, and now you want to take me into a gym and exercise, and I'm really not happy about that. Then it might be we have another professional on board to support the psychological side and work as a team, and that's that multidisciplinary team again to say, you know, we are here. I can give you a home program to start. And that might be that you work at home. It might be a virtual service from home, like a Peloton type thing where it's led live, but you're at home. And when you're ready, maybe a few weeks in, you're ready to come back into a gym environment. And maybe that's part of the psychological recovery of grading that exposure back. So really it comes back to the individual. What is the exercise the issue? Is it cognitive changes in life? And we're looking at how to help you in everyday life. So we're not trying to get you to run a marathon. What your goal is to be able to sustain a full day's work of whatever that is every day and not feel that you're peaking and troughing with your fatigue so much. So again, yes, it's tailored, and I think it has to be tailored because you come in and doing another boot camp for 8 weeks achieves nothing. Sorry, say that again.
My goal was to be able to walk up the stairs without being out of breath. That's basically what I couldn't even do that when I first left hospital. So.
And that's fine. And sometimes even when we're talking and singing how great this is, we are a very small part of a potentially very big journey. So really our goal is to act as a springboard to try and give people tools and advice and education and start this journey and hopefully leave them so that they can feel empowered to continue that and to know how to seek support going forwards as they need to. But by no means is this we take you and when we're finished you're a done deal. It doesn't work like that.
It's part of the rehab family.
Yeah, absolutely. Yeah.
Gosh, it really does sound so good, doesn't it? I mean, it really does.
I think if I'm gonna, I've survived 2 out of hospital cardiac arrest. I think if I was going to have another one, I'd want to have it in Essex.
Me too.
But Debbie's right about the restrictions and each service has to work around. So for example, Debbie's service will work at the hospital, but they cover a very large area. I'm sure she will agree and don't mind me saying. So they operate in different areas. Our patients will come to us. Other centres have a very big community presence in lots of ways, both during their rehab and afterward. So it is very different, but the professionals in every area I've never met anyone that doesn't. They will all have the same kind of ethic towards it and desire towards helping people with cardiac disease as a whole. So yes, those restrictions exist, but when I said reach out to your local team, they may be restricted in what they can offer you, but they will want to help you.
That's great. Thanks, David. Joanna, do you want to?
Yeah, there's another message from Zach. Thank you, Zach. Who says there are lots of free video programs for cardiac rehab on YouTube. That's another one of the methods you could use to help yourself. A really great piece of advice there. And then we've also had a message in from Jeremy who says, and this is quite interesting, my rehab was great, both physically, but also from a psychological point of view. Once I completed it, I wasn't sure where to turn for advice. And I found SCAUK who have given me the support I needed. And I must say, as we have been expanding our distribution of leaflets, more and more are requests coming in from cardiac rehab teams. So I guess that's something we need to focus on as well. that it's once people have finished with you, that they still need some support. But obviously, and going back to what Debbie said, there's a financial restraint on, there's not limitless funds, and we need to help ourselves. The message that SCA UK always say, help, be your own expert and help yourself. I'll come to you, Debbie. Not Debbie, sorry, Julie. I keep saying Debbie and I mean Julie. We'll come to you. Yeah.
It's okay. Talk about reaching out for support. Also remember the British Heart Foundation have a contact line. They have a professional nurse at the end of that line for any queries that you have as well.
Yep.
So you have also got the British Heart Foundation that have cardiac nurses that you can call, and they will help with certain things as well. And as that gentleman said, also the British Heart Foundation have videos online that you can follow as well. So the British Heart Foundation are a great source of support.
Yeah,
Our patients that finish cardiac arrest, finish the cardiac rehab program, they also have a thing called phase 4 cardiac rehab, which is long term, that you go independently, provided by an external provider that you pay for, and you can continue exercising with a professional that is specifically trained to exercise a cardiac patient. So that is also available as well.
So,
yeah.
So to give that some context, cardiac rehab consists of multiple phases. And so some of what we've been talking about are various phases of rehab. So what Julie's talking about is generally in an old term now. So if you're a cardiac rehab professional watching this, I apologise. But what we would still call phase 4. Okay, so long-term maintenance. So when we talk about seeing patients on the ward, we would refer to that as phase 1. When we start to contact you in the community and while you're recovering and start that process, we think of it as phase 2. The program that you will think of would be phase 3, where you come in or you do virtual or we have education. And then phase 4 would then be how we look at you, what's the collaborative plan for you for maintaining this going forward. Now, if it's exercise and some patients feel safe in that environment with expert supervision, but also with other patients that understand what they've been through and how they feel, then those exist, and there'll be exercise instructors very experienced that have had additional courses and support in continuing when we leave you, and there's a handover process for that. So that's what we talk about with the community. That's referred to for us as phase 4.
Thanks, David. Again, I'm conscious of time. It's about 15 minutes left, I think. I've got a topic sort of lined up, and I wonder whether this is probably a good question for Debbie. And she won't have seen this yet, so I'm going to. You're coming into this one totally blind, Debbie. I do apologise, but I'm going to bring it up anyway. How is eligibility for cardiac rehab assessed? Would it be fair to come to you for that one, Debbie?
We can answer that one.
Yeah. Oh, okay.
Oh, no. Okay, over to you, Debbie.
No, carry on. It's fine.
Okay, let's go to Julie. There we go.
So eligibility. So we would kind of probably call that criteria, wouldn't we? Really. So as we said before, we do have a criteria list of what you, if you're a heart attack, if you're a stent, if you've had valve or cardiac surgery, we are guided by that. And unfortunately, it is quite cutthroat in some ways, isn't it? You either have that or you don't have that. So we are guided by our national guidelines of what we are allowed to cover, and what our funding and our skill mix allows us to do. So yeah, we know the patients that we can target right from the start. Unfortunately, if you were so if we had a patient on the ward that was a sudden cardiac arrest, but no heart attack, no stent, unfortunately, the cardiac rehab team wouldn't engage with them on the ward. So straight away, we don't have that initial contact with them. So we have a set eligibility, and that's how we identify our patients.
It's fantastic for the people who get it, but it is heartbreaking to hear what incredible stuff you're doing and know that it's not available to everyone. I do understand it. It is a bit sad.
We want it. We want it for everyone.
I know you do. Of course you do.
Yeah.
I know it's going to come back to that age-old question of funding, but that's the one topic that really winds me up, because I genuinely don't believe it. We spend hundreds of thousands of pounds saving lives, and then we send these people back out to the community and do absolutely nothing for them. And the reality is, we're not talking about huge numbers.
Right.
We're talking about 2,500 survivors a year in the UK. It's a drop in the ocean in terms of the NHS budget. So it really winds me up when people say it's a funding issue. If we can't afford to look after them, why did we save them?
I completely agree.
No, I think we all agree. Can I ask another question? Can I squeeze in a question, Gareth?
Which can?
How much of cardiac rehab is to do with weight loss? I understand the fitness. What about weight loss?
There you go.
So again, we would see that really as either a very patient-specific goal. So a patient talks about that, but also when you're looking at, again, lifestyle management, behavioural change, it's trying to support that patient. Now, we might not be able to do all of their weight loss, but if that's their goal, then that's what we'll try and support through. So again, it is very different everywhere. We're very lucky that we work closely, and our dietitians will come in and deliver educational talks. And as Julie was saying, a lot of that is very seminar based rather than lecture based, if that makes sense. It's more like this. It's more a chat about what questions you have as people. There's no point talking through all the great proteins and everything in the diet if it doesn't mean anything to you and your lifestyle. So we will look at that. Lifestyle risk obviously then plays a part in terms of sort of waist circumference. So we know there's certain things in terms of obesity, weight management, waist circumference that link with heart disease. So it's usually a case of it being assessed, monitored. If it's something the patient is willing to address, because obviously some people are not. We sometimes come at them and they say, look, I'm already dealing with PTSD. I'm already dealing with all these new medications that I never had at all before.
Yeah.
I don't think I can deal with that right now.
Yeah.
And even if they're eligible for rehab, the window we have, they may not be ready to deal with weight management at the time we see them. Yeah, so it's more about empowering them to say, if you want to tackle it now, we will support you, exercise, diet, education, and help you monitor that. If you're not ready to tackle that now, again, it comes back to what are your goals? So it might be smoking cessation that we help you with, or return to work, or exercise. And if that's a goal in the future, this is that forward planning. This is that long-term maintenance. When you're ready to tackle that, do you know who to talk to, who to reach out to, and continue moving forward, if that makes sense? So it is looked at, but the same as any other risk factor. But we wouldn't badger someone about necessarily their weight and waist circumference if that's not one of their big targets for them.
No.
I think that's really interesting, David, because again, going back to my own experience, I smoked, I didn't exercise, and I wouldn't take an Anadin even if I had a headache. So, and then I'm discharged from hospital on what to me was a massive regime of drugs that I've never actually had to deal with before. I stopped smoking, and then I'm told to change my diet, and then I have to do all this exercise, which I wasn't doing before as well. It's a huge, and I'm dealing with the fact that I've just had a heart attack and a cardiac arrest. You know, I didn't even know the difference between a heart attack and a cardiac arrest when I left hospital. It was never explained to me. I had to find out for myself. So we're dealing with a huge number of changes, any one of which would be significant. And when you add them all together, it must be really challenging for you guys to deal with that on a regular basis. So many different people and so many different goals.
But I think that gets easier when you're dealing with the person and not the pathology. And I know that sounds really contrite, but when you and I are talking, Gareth, or Julie and you, or the team are talking with you, and when we say assessing you, we're having a conversation and we are coming to an agreement about how do we support you? What do you need? How do we hear you? So you're not hopefully not coming to us to say, right, that's the bike, that's the treadmill, you're going to do that, and then off you go, see you next week. You do that 8 weeks in a row, that's your program finished. It's more a case of, right, okay, where are you at? How I would say to our patients, where are you at in that journey? And if you said to me, I've never been on this, and you came across very upset, very emotional, very, in some cases, very angry, you've mentioned risk factors there, but we quite regularly see patients that, yes, had heart attack that led to it, but that will be very upset. I've never smoked. I exercise regularly. I look after my weight. My diet is very good. Why on earth has this happened to me? What have I done wrong? And now I'm on 10 tablets. I don't even take paracetamol. Whereas another patient could say, I smoke 40 a day. I've tried to quit. I'm 60 years old. I'm not going to quit, but I will tackle my diet, and I could probably lose a bit of this. So that's where it comes about. Okay, that's fine. How do we come up with a plan to support you with that, rather than welcome to the gym, here's your program, off you go and see it. Does that make sense?
Yeah.
So it really does. A lot of these questions come back to it's what that individual's needs are.
I think that's him. Sorry.
It absolutely didn't sound contrite. It sounded very reassuring, to be honest.
I think, as Dave said, it is very individualised, and as you said, Gareth, you identified that you had 4 or 5 different risk factors, and to tackle all those all at the same time is just overwhelming. So that's where we sort of, like Dave said, you assess with the person and look at which is the one that you want to tackle first, and then once you've looked at that, then we can look at a plan. So we're not saying to you, oh God, look, you're overweight, you're this, you're that, you smoke, you do this, you've got to change everything now. You've got to be, 1, ready to change. 2, as you said, you can come out with hundreds of tablets, you've just had this happen, you're psychologically not ready. So it's looking at all of those things as well, because we can easily say, well, you need to do this, but that's not what cardiac rehab's about. It is very holistic, very individualized, and looking at where you are in your journey, as Dave was talking about.
I think sometimes it's not even you're psychologically not ready. You don't even know that you're psychologically not ready.
Yeah, that's it. And it's overwhelming, isn't it? It can be very overwhelming to have all this new information and everything going on. Yeah.
Okay, we've got a couple of minutes left, literally just a couple of minutes left. I'm going to miss a question, and I'm going to bring up the last one because I think this one's quite interesting, and I don't mind who attacks it. What support, if any, and the answer to this might be none, what support, if any, is available for co-survivors and family members?
Oh, I can answer that one. So the support, obviously, you've got your charity, which is so important. And I think we rely so heavily on charities that are running, and they're invaluable to our patients and to us, because the literature and things that you provide to us are so valuable. But a lot of centres will also have cardiac support groups that are run by patients that have had events that run continuously. So we have one called Hearts and Minds that meets once a month on a Wednesday evening, the first Wednesday of every month. And they meet up and they're a great peer support for themselves. So you've got the cardiac support groups, and a lot of people will make friends in their cardiac rehab, and then they build their own little support groups as well. And they meet and they go for walks. But there's lots of community support that are available. You have, walking groups and it's not just about the activity. You have groups in your local library that I saw one today about gaming, a man's gaming group. And it's just about getting together and chatting, because you never know sometimes what other experiences people have had. So the support groups and charities are the most invaluable asset that I think you have as well to support you, family members.
And the last thing I would add to that is, so whether or not you've got cardiac rehab, most of these support groups would take any cardiac patient at all. They don't have to have had cardiac rehab to be eligible for that community networking. Does that make sense?
Yeah.
It might be harder to when they exist.
Yeah.
So if you didn't know, you could ring your local cardiac rehab team and say, again, I appreciate you might not be able to see me, but is there a cardiac support group I can reach out to?
There's a list in the British Heart Foundation as well, where they all are.
It would be remiss of me not to point out that Southern Cardiac Arrest UK is the best peer support group, not just in the UK, but actually in Europe.
Well done.
Okay, it is now 8 o'clock, and we do nominally say an hour, so I am going to wrap things up unless anybody has anything they desperately want to add. No, okay, so I'm going to wrap things up for this evening. Guys, if you're watching on YouTube, do give us a thumbs up, do like the video, do subscribe to the channel. It does help us to get up the YouTube algorithm ladder. And the higher we get up the ladder, the more people can find us. The more people can find us, the more people we can help. So it is important to get everybody to get the likes and the shares and the subscribes and that sort of thing. We will be back. We'll be back on Tuesday in 2 weeks' time. This is nominally a Tuesday evening. We haven't been on Tuesday evening for about 2 months, but next time we will be on Tuesday evening, the 18th of November. That will be an episode all about fatigue. It's actually called Managing Fatigue, and that will be with myself, Joanna, and Claudine Keelan, who is an occupational therapist specialising in cardiology. And I suspect she's also from the Essex Cardiothoracic Centre. I'm not entirely sure about that, but maybe not. So we will be back with that episode in a couple of weeks' time. And also on the outro video, you will spot, as always, you'll spot a couple of QR codes. One is for you to donate to Sudden Cardiac Arrest UK. One is for you to buy something from our shop. Another way of donating to Sudden Cardiac Arrest UK. We are a charity. We are funded by donations. And as I always say, yes, I know Facebook is free, YouTube is free, Twitter, as it used to be, is free. But it's not free for us. It's not free for us to actually provide all this information and provide these videos and run these streams and such like. So you don't have to do it, but if anybody's able to do it, do feel free to scan the QR code and make a donation or buy something from the shop. Okay, so with that, I am going to wrap it up for this evening. So from Joanna, Debbie, Julie, David, and myself, thanks so much for being here. Hope you enjoyed it. Debbie, Julie, and David, also, thank you so much for being here. I know we put this together at the last minute, so we really appreciate your time and taking your time this evening. So from all of us, thanks for watching, and we'll see you on the next one. Good night.
Bye.
Bye.